At the start of the 20th century, we saw one of the largest conflicts in human history. A war fought on 4 continents, a war that ended the lives of millions and created countless widows and orphans. And in 1918, that war finally ended. However, something else took its place. Something that was going to cause more deaths than the Great War ever could. That something was the Spanish flu. The first reported case of the Spanish flu came from a military camp in Kansas. Within days of the first case, hundreds of other soldiers came down with the flu as well. Within weeks, major American cities were hit. However, it wasn't serious. Patients showed normal flu-like symptoms and a majority recovered within a few days. The death toll was relatively low and everything went back to normal. Soldiers trained as they would, and some would even go overseas to fight. The second wave of the Spanish flu came in the fall of 1918. This time, the virus spread like wildfire. Apparently, the flu had been spreading through the trenches on the front lines. Soldiers returning home brought not only the horrors of war, but also a virus. A virus that would spread all over the world, leaving a death toll not easily forgotten. That virus was a strain of influenza known as H1N1, or swine flu, a flu that originated from pigs. Those infected suffered from typical flu-like symptoms such as fever, chills, cough, congestions, and shortness of breath. Other symptoms include hemorrhages that fills the lung with blood, causing catastrophic vomiting, nosebleeds, and finally suffocation. Interestingly, the Spanish flu was most deadly against those who were 20 to 40 years old. This was peculiar as flus generally affected elderly and young children the most, those with a weak immune system. Outside of that, there was no cure or vaccine for the flu. In fact, a flu vaccine would only be developed in the 1940s, more than 20 years after the pandemic. Doctors at the time could only do their best to treat the symptoms. They would prescribe drugs that would supposedly help. The reason the 1918 flu pandemic is often referred to as the Spanish flu, because Spain was one of the few countries which openly reported about the flu. Spain was a neutral country while other countries were under wartime news blackout. Even though the virus was equally bad in all countries, people just assumed it started or was worse in Spain, because it was the only country accurately reporting the situation. Even so, all countries pretty much had the same reaction to the virus. Schools, businesses, and non-essential services were shut down, public gatherings were banned, and if you needed to go out in public, you had to wear a face mask. Though at some places, you weren't even allowed to go out in public without facing fines or other consequences. As the flu worsened, many private buildings and businesses were transformed into makeshift hospitals. Medical students in their second or last years were quickly rushed to make up for the lack of doctors and health personnel available. By late 1920, the Spanish flu came to an end. Those infected were either now immune or simply dead. In total, an estimated 500 million people were infected, about 1/3 of the global population at the time. And an estimated 20 to 100 million people died from the Spanish flu. It's hard to get an accurate estimate on the death toll as the Spanish flu took place a century ago and medical records weren't kept or simply lost to time. Anyways, to put those numbers into perspective, if we were to adjust the numbers of those infected, 500 million, and the numbers of death, let's say 20 million, into today's global population, we would see 2.6 billion people infected and at least 100 million deaths. If we were to use 100 million deaths instead of 20 million, we would see 520 million deaths. The Spanish flu is one of the deadliest pandemics in human history. Unlike other pandemics, it didn't affect one or two continents, but in fact the whole world. 100 years later, we face another global pandemic. While COVID-19 may not be as deadly or as scary as the Spanish flu, it doesn't mean we shouldn't take it seriously. Just because you're not a young child or older than 65 doesn't mean it's not a threat. Please take care of yourselves and those around you, practice social distancing, wash your hands often, be careful when touching any surfaces, cover your cough and sneeze, and wear a mask if you're going outside. This is definitely a tough time, but we will all get through this. If you enjoyed the video, please like and subscribe, stay safe, and see you next time.